think it's appropriate and relevant that a part of the sessions we're having today to mark World Mental Health Day is a brief presentation about autism. 1 in 100 adults have a diagnosis of autism, and actually among the student population we think that figure is likely to be higher. But perhaps more critically, this is a population that are at very high risk of developing mental health difficulties. 80% of adults with autism will be diagnosed with a mental health problem, and that compares to 25% in the general population. In terms of the issues they experience, it's issues around anxiety and depression are most pertinent, but also much higher rates of suicide. So in terms of how the research and clinical community have responded to that, there's been work developing interventions to try and treat mental health difficulties in this particular population, and also work to look at, well, what's it like to be a service user with autism in mental health services. The project I want to tell you about today offers a different and a new perspective on this issue, because what we were interested in was, well, what happens before these people even reach the services that might be able to help them? How do they make sense and understand their emotional worlds? Is it different to non-autistic people? How does diagnosis of autism affect what they do and what they make sense of their situation? We chose to do this piece of work specifically with a group of young adults with Asperger syndrome, and they were a group who were very carefully selected to represent a range of mental health experiences and issues. And just to acknowledge, we're doing this work in partnership with the Institute of Psychiatry in London, and it's part of a wider programme of work we're doing them on mental health and autism, which is funded by the National Institute for Health Research. So, it was an in-depth, qualitative study interviewing these young adults with Asperger syndrome, generating a very rich data set, and I'm going to just give you some very headline findings. So how did the young adults we interviewed, how were they making sense of their negative emotions and wider mental health experiences? There were two very key themes that came out of our discussions with them. Firstly, their understandings of their emotions, their mental health experiences, were grounded in inaccurate understandings of autism. And this played out in two quite different ways. Firstly, there was a key theme that they understood, or their understanding of anxiety was it was an inherent part of autism. It was like a diagnostic feature of autism. And secondly, and differently, they believed that mental health problems were an inevitable consequence of having autism, and that was very much located around their social impairment and the consequences that it had in terms of quite traumatic social experiences such as bullying, but also the emotional demands of managing social situations on a day-to-day basis. They believed inevitably took a toll on their mental health. So their understandings of their mental health were very much being located in their understandings of their diagnosis. Second theme was how they were making sense of their mental health and their emotional experience was a very private process. There was very little reference to others in order to gauge their wellness, and there was very little attempt to talk to others about how they were feeling and making sense of that. So what are going to be the consequences of the way they've made sense of their situation in terms of how they respond and how and whether they seek help? So because they believed that many of these mental health symptoms were an inevitable part or inherent in the diagnosis with autism, the notion of seeking professional help and support was regarded as simply not an option. Not even a possibility, not worth trying. And this position for some, but not all, was influenced by earlier experiences in childhood of ineffective interventions. So because that wasn't seen as a route to go, the result was they self-managed, and they spoke very eloquently about how they, in a sense, were self-prescribing strategies and techniques to manage their mental distress and to avoid situations that were causing that distress. And typically, that involved removing themselves into private space. So their whole dealing with their mental health was a private and hidden struggle. And then the sort of lead on to that and the subsequent consequence was, from the sample we interviewed, was that the difficulties only became apparent when they were really in crisis, or their physical health had got to such a poor state that people were noticing and felt they had to do something. And importantly here, even at that time, it took another person to facilitate them into a service, and that was typically their parents. So one of the questions we had was, we need to locate this in our wider understanding of how young people and young adults understand their mental health and how they go about seeking support. And we know generally that young people, young adults try to normalise their symptoms and they self-manage. And we saw all that going on in our sample, but importantly, there were differences why that was going on. So we had our young adults definitely normalising their symptoms, but they were normalising it in terms of their diagnosis of autism. They were certainly seeking to self-manage, but not because they wanted to avoid the stigma of seeking help from a mental health service, but because they saw those services as having nothing to offer them. And a third thing they mentioned was that the way people interpret their behaviours and their symptoms are different to how they might be interpreted in others. So whereas social withdrawal might be a cause of concern for a typically developing young adult, that is seen by others as normal and how you've always been. So, next steps for the project. We feel there's important useful evidence here, and it's certainly in line with other research that mental health support and provision for people with autism needs to be autism specific, at least for some people. But also what we think this project is adding is that it needs to include strategies and interventions to improve young adults and their families' understandings of autism and mental health and the interplay between the two. So our contribution to this and the final stage of this project was we were co-producing a film with some of our interviewees where they will talk about their experiences and their feelings, and that will be interweaved with educational input and resources and signposting. And then the final stage of the project will be some guidance for professionals both working in children's and adult services, and that element of the work we're doing in partnership with the National Autistic Society. If any of that's been of interest, please do get in touch.